Thank you for joining the Rethinking Candida webinar. We're going to learn how to approach Candida from the biological medicine perspective. My name's Heather Schofield, and I'm the Education Director Medical Advisor here with Biomed. I've been working with patients and Candida for over 20 years, and bringing it into perspective from the biological medicine approach is a really interesting way to think about Candida. And it's not then just thinking about Candida, but it's also the ability to understand how it works in the body, understand why it goes into an overgrowth situation, and then what to actually do from a much deeper roots perspective to get the overgrowth back down into the normal physiological and biological numbers within the microbiome. And so that's a big part of what this webinar is about tonight, is going to be talking about Candida from a more morphological perspective and from a terrain perspective, and then what to actually do about it so that you can get those long-term results with our patients. Why do we need to rethink our approach to Candida overgrowth? And this is many of the reasons why. Candida is what I classify instinctually intelligent, and it adapts to the signals from the body's environment. And so understanding what this instinctual intelligence is all about, and then understanding what some of the signals are the two ways to really successfully get in there and be able to start to address Candida in a much more kind of holistic and environment terrain perspective. So, and each of these points, we're going to go through them. There's slides on all of these points, but I just want to do kind of a quick overview to set everything in stage. So the Candida morphology, it has different forms. It goes from its more kind of cyst form into a hyphae and pseudohyphae forms, and that's what creates these big kind of growths with Candida. And then it has that ability to be pleomorphic, and the pleomorphic means that it can change shape without actually changing function. So both it can upregulate into the more pathogenic forms, but then it can also downregulate into its less virulent and more symbiotic forms as well. Candida also, in this instinctually intelligent space, it's very adaptive, and it has incredible survivor abilities within the body. And so one of the things is when it starts to feel threatened, and so once Candida has started to overgrow, and then let's say antifungals are put into play, whether those are prescription or they're natural herbal, or there's a lack of sugar available in the gut, then Candida is going to start to adapt. It's a sugar lover, and it's going to move towards the capillary beds where there's blood, and so therefore there's sugar. And this is how Candida can become very systemic within the body. And then when it's there, the body has way less ability to be able to deal with it. So the immune system's not able to actually deal with it in the same way. Candida also has the ability to create really incredible biofilm. And this biofilm then almost becomes impenetrable. And so antifungals and antibiotics and all kind of natural formulas that are trying to get at the Candida have a physical barrier where it can't actually get to there. And Candida also secretes a lot of endotoxins and exotoxins, so this kind of creates this biochemical barrier as well, so the immune system can't actually recognize it. So it can basically hide in plain sight. And then as I mentioned about the food sources, if Candida is not able to get the food that it needs within the gut, then it's going to go and look for those sources of sugar deeper within the body. And if the client is dealing with a leaky gut situation, then it can easily make it through the gut and become much more systemic. The other thing, too, just as a note with Candida, all of our mucous membranes are intrinsically connected through the entire body. And this is why when we're going to be talking about Candida, we need to take a systemic approach, not just a localized approach. So if a female client is dealing with a lot or reoccurring vaginal yeast infections, then we don't want to just topically or locally address the Candida. That's part of the picture, but we also need to go more systemically in the body and get things balanced as well. I've got a really nice protocol that will outline how to do that towards the end of the presentation. We also need to understand about Candida's connection to heavy metals, or mercury very specifically. Interestingly enough, Candida can hold up to 150 times its own weight in mercury in kind of its cell wall in its body. And I've got a study to show this within the presentation. And so Candida is definitely a binder and sequester of heavy metals, mercury specifically. And when we are working on reducing that overgrowth in Candida, we need to keep this point very specifically at the front of our thoughts when we're working with patients. Sometimes those Herx reactions may be a heavy metal detox or overwhelm in the body instead. We also have that detox, that die-off, and those Herx reactions. And what we need to do, again, forefront of our minds is be thinking about detox pathways and also be thinking about binders like chlorella, for example, when we're working with Candida. And then finally, as I mentioned, those mucous membranes are intrinsically connected in the body, which can explain some of the systemic growth of Candida that we witness. And then there's that biofilm, and then the diet, which we'll talk about in a little bit more detail as well. And this Candida diet, at least the biological medicine Candida diet, is a very reasonable diet that people can actually do with a lot of success. And it does involve some natural sugars in it, so it's not a complete 100% no sugar diet. And I'll explain that in more detail shortly. Okay, so let's talk about Candida a little bit more and then some of those other points before we start to talk about solutions for overgrowth. So Candida does have a symbiotic role within the body. There's over 81 species of Candida, and it's a naturally occurring yeast in the form of fungus. It is part of our microbiome, and it will be found in small numbers in our flora, specifically of the mucosa of the mouth, the throat, the intestines, vaginal mucosa tissue, and the urogenital tract. When it's in the symbiotic form, it's not causing any symptoms. However, when it starts to upregulate and create those mycelial or kind of tentacles and legs, that's when it's moving into its more pathogenic form, and that's where symptoms will be able to be seen and observed. That symbiotic role within the body, so Candida helps to aid in digestion and nutrient absorption. It binds heavy metals, specifically mercury, that's in the mouth and the gut. And that's actually an interesting point because a lot of the time when we're thinking about Candida or Candida overgrowth, we're thinking about this as a microorganism or a fungal species and as a bad invader or like the enemy. But what I would ask you to think about is perhaps Candida isn't really the enemy at all, but it's overgrowth. And when you're seeing Candida overgrowth in general, perhaps it's actually trying to work and aid the body and still be that symbiotic species and play that role, for example, by binding those heavy metals. So if the mercury load is high in the body, often Candida will be high as well. And if Candida is able to sequester and basically kind of absorb or hold on to mercury in the body, perhaps it's actually being a protector rather than a nuisance. And that's the greater indication that the mercury level is also high in the body. So just, kind of food for thought when we're rethinking about Candida. Candida, of course, at the end of life, it aids in the decomposition of the body. And for those of you that like to also think about the more body-mind, emotional space, Candida also helps to magnify emotional need and strengthen personal power. I do have a bit more information about that in more specifics shortly. And then just as an interesting fact, 90% of newborns are born with the normal budding Candida fungus in the gut. And this Candida is a non-pathogenic and asymptomatic form. So it's in the healthy budding form or the symbiotic budding form of Candida, and it's part of the normal flora and fauna microbiome in the body. So then the next question is, so Candida is existing within the body. What causes overgrowth of the Candida? And this is where we need to start thinking about the microbiome, the terrain or the environment of the body, and also the immune system. These are all the things that help keep the Candida populations naturally under control. But when overgrowth occurs, it's because the flora starts to become altered, and that can be triggered by diet. And it's not kind of a one-day diet, but this is like an over-time diet that often our North American diet for the average person tends to be on the acidic side. There's lots of refined foods, there's lots of protein, there can be lots of sugar, and these are all types of things that put our body into a more acid-base imbalance space. And once that acid-base imbalance starts, then that also can trigger Candida to start upregulating. Alcohol consumption, it's also part of this picture, high stress, antibiotic or antifungal medication use, and that is because it throws off the microbiome and it changes the makeup of that. And if we're taking out healthy intestinal flora, then you're creating space for Candida to overgrow, and you're also taking out some of the patrollers that keep Candida under control. This is the same situation with oral contraceptives and steroid use. And then finally, that increased heavy metal load, specifically with mercury. And this could be done, of course, through amalgams or fillings, through eating tuna and other large predatory fish, and some of the shots that we also receive through our childhood schedule. Now, the results on how this overgrowth occurs is you have the internal environmental change within the body, so an acid-base balance change. You've got increased inflammation, the flora and the fauna, so the intestinal bacteria start to change, and the immune system becomes weakened. And then all of these things contribute to that environmental change within the body or the terrain change, which then contributes to Candida being able to shift or adapt to this changed environment, and that typically becomes into its more pathogenic forms, and then this is what's causing symptoms. So this is kind of how this whole cascade works, and what we need to do then is look to address these types of issues to be able to reverse it back. And so kind of this pleomorphic idea with Candida, or if it's pleomorphic morphologies. So Candida albicans is pleomorphic. It is able to change from one form, the budding form, to another form, the mycelial form, and do this in different environmental conditions within the body. And it's this mycelial form that causes symptoms. So the budding form is physiological or classified as mutualistic. The pseudohyphae, it's triggered by pH change and a decrease in the flora. And then the mycelial or the hyphae form is that fungal pathogenic form. And that's where you tend to see a lot of kind of the legs or the tentacles that kind of span out. Now, with that pleomorphic shift, again, as the environment within the body changes, you have that budding form going into the pseudohyphae form, so you start to see those tentacle growths, and then you have the maturation into the mycelial form. And then from there, there's this thing called dispersion, so you get new budding forms that are growing and then are released, and they end up spreading to different areas in the body, so spreading more to the mucous membranes. This increases or is part of the whole growth or overgrowth, and this is kind of how it all happens. And then in this diagram on the left bottom side, Candida albicans, you can see how it's pretty stacked, and then it also has this extracellular matrix that's all kind of bound into that as well. So a few interesting facts about Candida. It's classified as a diploid organism, so it has 8 sets of chromosomes, and it also has a diploid gene, and this is what is able to indicate that it has that capability for pleomorphic activity or to be able to change its forms. So it goes from that budding form to the more pathogenic mycelial form, and that's, as I mentioned before, that mycelial form is the one that causes symptoms. This is all triggered by that internal milieu change in the gut and the tissues as it becomes acidic, and then also things that can kill off our friendly bacteria, cause inflammation, and a stressed immune system. Then when Candida is getting a lot of sugar, so if it's a diet that somebody's eating with a lot of refined sugars in there, one cell increases to 100 cells every 24 hours. So by the fourth day, you can have 100 million new Candida albicans cells within the system. So things can proliferate very quickly when things are really out of balance. And once again, as we're rethinking our approach, we have to think about that environment so that the Candida doesn't get into this situation in the first place and it stays in that budding yeast form. So just a little bit more about this for these pleomorphic changes. So just as a kind of reminder again, those pleomorphic changes happen when that internal milieu of the gut and the tissues becomes acidic, when the friendly bacteria are killed off and the immune system is stressed. And so it will move from a mutualistic to a commensal to a parasitic form, but then it can also reverse back as well. And so in the rethinking portion of all of this, we need to not concentrate on this idea of killing Candida, because in the realistic world, it's actually going to be completely impossible to kill off every single Candida form in the body. There's just too many reasons and too much coverage within the body for that to happen. And so instead of concentrating on killing the Candida, we need to really focus on converting the pathogenic pleomorphic forms back into their natural budding forms. This is a very achievable thing that can happen and happens relatively quickly within the body. So you can do this and achieve this in 1 to 3 months with patients when you're focusing on this biological medicine approach and working with the terrain. And again, this only occurs when the environment or that internal milieu is addressed in the body. Okay, so then, so let's start talking then about biofilm. This is this instinctual intelligence portion of the Candida talk. So biofilm is this protective layer that microorganisms build around themselves. And so when this happens, you get Candida. In this case, Candida will adhere to the surface of the mucous membranes, and then it creates this polysaccharide extracellular matrix made out of things like calcium, magnesium, iron, and mucus. And then fibrin is added as a protein fiber mesh that holds everything together. And this is what the makeup of biofilm looks like. And so as it grows, and then you have this biofilm and then this kind of protective coating over top of it, as I mentioned before, the immune system, and then also other things like, you know, natural herbal formulas or whatever you're using to try to get at the Candida, it really can't penetrate this very well. And then the Candida will create Candida babies in the form of those yeast forms or these yeast budding forms, and then they disperse and they continue that population up to, you know, that 100 million in 4 days. So once again, we got to be focused in on how do we break up this biofilm, but then also how do we work on the environment in the body to get that changed so Candida can reverse back. And so here's another point about biofilm. So biofilm also, it's not one species of bacteria or fungal species in a biofilm. It's made up of many things. And so this is just an example of biofilm with Candida albicans and Streptococcus all kind of put in there. And interestingly, then this biofilm becomes resistant to antibiotics and antimicrobial treatments. And this is partially due to this polysaccharide matrix that it forms. And then there's, with the staph, you've got all kinds of things that are formed around that. So it creates this really incredible impenetrable fort that these fungal and bacterial species then can flourish in. So the very first thing then when we're dealing with Candida, there's many firsts, but one of the big first things is definitely to think about these biofilm disruptors. And there's lots of really great products that are available that will actually break up biofilm naturally and safely and very gently within the body. And so there's three things that have to be thought about with breaking up biofilm. One is breaking up the mucus, and then number two is breaking up that fibrin mesh network around it. And so to break up mucus, one of the easiest ways to do this is to use a systemic enzyme or a proteolytic mucolytic enzyme. Serrapeptase happens to be one of these enzymes. It's actually classified as both a proteolytic and mucolytic enzyme, and it breaks mucus up very specifically. So it's a really good biofilm breaker. It's also a great anti-inflammatory and does many other things, but specifically for biofilm, serrapeptase is one of the real strategic ways to think about doing that. And serrapeptase, of course, it has lots of great benefits, and I always kind of think of this biofilm breaker as one of the side benefits to work with it if you're using it as a systemic enzyme. We also have Clearzyme, which is a combination of different proteolytic enzymes and mucolytic enzymes, and it also does include serrapeptase in there as well. And then next, if you want to break down the fibrin, then using a fibrinolytic enzyme is going to help break that fibrin down, and cysts or capsules are also made of a fibrin network, so it helps to break that down as well. Nattokinase is a very specific fibrinolytic enzyme, and so is lumbrokinase. In Canada, lumbrokinase is not a permitted enzyme. You can't get an NPN on that one, or not that I'm aware of at this time, but you can definitely get it on nattokinase, and so then that becomes a really great way to break that fibrin network down. There's also, of course, additional benefits with nattokinase because it will break up excess fibrin in the blood. It will break up the fibrin where blood clots can grow on. And then if you've got excess fibrous tissue in the body, so for many women, increased fibrous tissue in the breasts or kind of the uterus, then nattokinase is a really good enzyme for that as well. And then finally, when you're breaking up this mucus or this biofilm, you have to also think that then you're going to mobilize the biotoxins and the different pathogenic species out of the biofilm. So you want to get things in there that are going to help to bind onto that as well. And so when you're binding or mobilizing, you need to think about binding these biotoxins very specifically. And sometimes this is where you get those detox reactions or those Herx reactions if you're breaking this stuff up and you don't have something to bind it onto. Then it can create a load of toxins and endotoxins and exotoxins and biotoxins that overwhelm the body and the detox pathways. So binder is super important as well. And so binders include things like chlorella, also fulvic or humic acid, pectin can be used, and one of the things I like to recommend is actually green apples because they contain quite a bit of pectin, and it gives an opportunity for food to be medicine. I wouldn't use green apples all by themselves, but just as an additional binder when you're working on this can be pretty helpful, and apples or green apples are definitely permitted in a Candida-like diet. Also, we have a product called Pleomorphic, and it helps to break up mucus and kind of bind on as well, so that would be something also to think about. And Hydrastis nasal spray, if you're working on biofilm in the sinuses or post-nasal drip or in the nasal cavities, then Hydrastis very specifically is a biofilm breaker as well. Okay, so with that biofilm information under our belts, then let's move on to talking about Candida and the connection between Candida and Mercury. And so I've got two really good pieces of information here. If you haven't heard about the Mercury-Candida connection before, then definitely pay attention to this bit. So Dr. Dietrich Klinghardt, who's a world-renowned chronic infection doctor and also an expert on mercury detoxing, talks about Candida yeast overgrowth is one of the ways our body tries to keep mercury and other heavy metals from damaging body tissue. So as I mentioned earlier, this is one of those things about rethinking of Candida. It's trying to bind on and protect the body tissues. The yeast serves the purpose of absorbing and sequestering heavy metals, and the body proliferates yeast to protect the rest of the body from the heavy metals. Dr. Klinghardt also was talking just recently about the fact that Candida can have that 150 times its own body weight in mercury kind of within its body cells. And so I've got a study, the next slide, to illustrate this. Now, we've also got Dr. Thomas Rao, who's a medical doctor at the Paracelsus Clinic and world-renowned biological medicine doctor. And he talks about, from the biological medicine perspective, Candida valencies, or kind of the, Candida non-pathogenic and pathogenic forms. They occur when the milieu is severely blocked. So that's the terrain in the body or in the environment. It's severely blocked by things like toxins, very frequently in cases of heavy metal burden. Candida symptoms are often the same as mercury intoxication or mercury toxicity. Also, chronic dental foci and amalgams can be associated with Candida. And when root canals are actually removed, those extractions, Candida cultures are found in the pulp and the roots of that. So there's definitely a big connection with Candida overgrowth and mercury and dental issues as well. Candida has the ability to bind onto heavy metals in the mouth and the gut, and stool analysis showed positive results for Candida when there was amalgams in the mouth. So they were seeing increased amounts of Candida and increased amalgams or heavy metals, specifically mercury, with the stool analysis. And so making that connection with increased mercury and Candida in the body. And then finally, diverticuli are hotbeds for Candida and heavy metals. So if you have clients that have diverticulosis or diverticulitis, then definitely put Candida and heavy metals at the forefront of your mind when thinking about how to help with those types of conditions with patients. Now, the Mercury-Candida connection, there is a journal called the Microbial Biotechnology Journal, or the SFAM journals. And they are open source, so you can go in and you can read all kinds of really great articles. And this was an article or a research study that was done on heavy metals, mercury, and Candida species, and talking about this thing called bioreduction, which means that the Candida was introduced to mercury load, and it found that the Candida not only survived, but it actually absorbed in the mercury as well. And so on the left-hand portion of this slide, what they were able to do was within the Candida biofilm, with an electron microscope, see the mercury balls. So when mercury all kind of comes together, it forms these little silver balls that can roll around if it's on the surface. But within the Candida, they were able to identify what these balls, and found then that there was an increased amount of mercury in the biofilm because the Candida absorbed it. And then on the right-hand side here, you can see that mercury was not only being absorbed, but also found intracellularly within the Candida as well. And so once again, as I mentioned, this rethinking part of Candida, you definitely have to think about mercury and mercury load when you're thinking about Candida. And so if somebody has Candida symptoms, the likelihood is that their mercury load is higher as well, which then means when you are working on reducing Candida in your protocols, you need to pop something in there that's going to help bind onto the mercury as the Candida is basically dying off and releasing this mercury back into the system. And as I mentioned before, that process often starts to get related to detox reactions and even Herx reactions. Now, with Candida, so let's move into talking now more about Candida and with the symptoms. So some common symptoms or things that you might see are coating on the tongue, a yellow or white coating on the tongue. There's lots of skin rashes that can occur, and nail fungus. And I've got a really great protocol to talk about from a nail fungus perspective on how to get it cleared up really nicely and within a decent amount of time as well. And so just before I actually talk about these very specific symptoms, there's a question that David had asked about Candida binding onto other heavy metals as readily as mercury. Now, within this actual study that I mentioned in here, there is some other heavy metals that are talked about. Lead, not so much like inside the Candida, but within kind of the cell walls. You can kind of look and see. I'm more than happy to, the link is there, but I'm more than happy to put that into the PowerPoint, the follow-up email, and then you can read with the other types of metals. It does bind on to other metals. However, mercury is a very specific one that is most frequent and the most prevalent, and usually the one that has to be addressed with within a protocol. Okay, so then let's get back to the symptoms of Candida overgrowth. I've categorized this here: digestive issues. So very common, most common, gas and bloating, some type of intestinal disturbance like diarrhea or constipation, leaky gut, and sugar cravings or fruit intolerance that maybe causes brain fog. The nervous system, energy, and mood become the next ones that are often seen, so like brain fog and fatigue. Also can create autonomic nervous system disturbances, depression or mood swings, fibromyalgia and chronic fatigue can also be associated with high Candida. Immune issues, because once that biofilm gets going, it can create a lot of inflammation in the body, and then that gets the immune system pretty busy, and so then you start to see things like allergies, hives, itchy ears, and then autoimmune conditions like Hashimoto's, rheumatoid arthritis, or ulcerative colitis. Skin and nail issues are also fairly common, so skin rashes and rashes that don't tend to respond to a lot of things. The rashes tend to be pretty itchy, they might be flaky, and they often will have an odor to them as well. Nail fungus, fingernails and or toenails, and then athlete's foot or joint jock itch. And so again, kind of itchy rashes that tend to be in areas that don't see a lot of the sunlight. And then finally, urogenital issues. So for women, chronic yeast infections, urinary tract infections, itching, and bladder infections as well. Now, with all of these types of things, these are all potential symptoms or conditions that are associated with Candida overgrowth. Now, because with a biological medicine approach, we're always working systemically in the body by the simple protocols and actually a very simple remedy, it can help pretty much address this entire thing as long as it's done very strategically. And so there isn't a lot of change as far as protocols go, or what kind of you would put within a protocol. Most of these issues from a biological medicine perspective all are getting to that root cause of changing the environment, strengthening the immune system, supporting the flora and the fauna, the kind of microbiome, and downregulating Candida, doing it responsibly by making sure the detox pathways are open and you've got binders to grab onto any mercury that's being released or any toxins, and that you've got something to break up the biofilm. I just gave away the protocol, so don't worry, I've got a slide that illustrates it in detail. Okay, so then let's talk about testing. So how do you know that your client has Candida? You can go based on their history and their symptoms. There are some really great Candida questionnaires that exist. The Dr. Crook's Candida questionnaire is a really good, thorough one, and you can just Google that and see what that questionnaire looks like. There are blood tests that you can find Candida antibodies. They may be negative when the stool or the urine test positive. There's stool testing. Candida levels in the lower intestine and colon, it's going to help to identify that using a comprehensive stool analysis. And then you can also see what types of species are involved. If you use doctor's data, then it will also tell you what specific herbal or antifungal natural formulas can be helpful. like caprylic acid or oregano. As I mentioned, we're not really, from a biological medicine perspective, doing a kill approach. We're doing a change the environment approach, so these may or may not be relevant. You can use the urine organic dysbiosis testing, which looks for waste products of Candida overgrowth, as binatal, and so that helps to determine if there's Candida in the upper gut, small intestines. There's also a super easy spit test that you can do. I'm not sure how scientifically accurate this is, but it can definitely give you an indicator if there's something going on. So you spit in a glass of water first thing in the morning, and then you check every 15 minutes for an hour. If the saliva grows legs, becomes cloudy, or has floating specks or sinks to the bottom, it can indicate Candida. If the saliva remains clear and it floats, then there's no Candida overgrowth. The two things that I really like to do when I'm just really doing a high-level kind of check-in on Candida with my own patients is I always ask about gas and bloating and kind of digestion in that respect. And then I also ask them to stick out their tongue so I can see what the color of their tongue is and if there's a coating on it. And those are some really quick ways to kind of do a check-in to see maybe if Candida is something that needs to be investigated a little bit further. Okay, so now to touch in on Candida as far as the emotional side of things, Candida overgrowth and emotional healing. So the root of Candida is not always what you're eating, or in many cases, maybe it's not always just even about your terrain, but it can also be a window into your emotional needs. And those types of emotional needs for people that have Candida overgrowth, these types of things might resonate with them. They need to grow stronger in their personal power, knowing that they're not a victim, even though they may feel like they're a victim. Stop blaming and complaining, which can be a very negative space. And also, if they feel like a victim, they may be trying to blame or complain about that. Release repressed emotions like shame, guilt, and anger. Set boundaries and do what you love with no holding back. And so there tends to be a lot of victim energy with Candida. So releasing that victim energy, which can feel like you're very scattered, frustrated, or angry, poor me, helpless, hopeless, overwhelmed, burdened, struggling to find balance in one's life, untrusting, or distress in relationships. So those are kind of the more body-mind things to be considering about with Candida overgrowth. And in some cases, with stubborn cases where you've done lots of work and it still just seems to be Candida is not budging, then sometimes you need to move into the more emotional space to help the client release those types of things, and then the physical symptoms of Candida will release easier. So healing Candida is a journey of self-awareness and empowerment. Now, let's start talking about solutions. So the biological approach to balanced Candida. A healthy gut and balanced intestinal flora will lead to proper digestion and a strong immune system. And these types of things are the utmost importance for health, of course, in general, but also eliminating Candida and fungal overgrowth. And so these are going to be the things that we start to talk about next. I want to make some comments on a Candida diet because I know when I talk to practitioners and talk about helping their clients with Candida, one of the questions that always comes up is diet. And this, because most of the information out there, if you start to kind of Google search, or you've got clients that are Google searching, they're going to find that it's a no-sugar diet. A Candida diet usually involves no sugar. And so according, again, to Dr. Rao, if we try to starve Candida from sugar, it's just going to go deeper in the body looking for it. So as I mentioned at the very beginning, Candida then will move across the intestinal membrane and then get to the capillary beds where it can get to sugar. And so an ideal Candida diet that will also be allowing for success is a more alkaline diet that is low in protein, so 60 grams a day is about all the body can handle. Any more, you'll get increased acidity within the body. And so protein, more plant-sourced, and then lean proteins like chicken or turkey and fish, but not all the small fish, not the big predatory fish, are recommended. More alkaline diet. The body is naturally slightly alkaline, especially in the gut. And again, if we're talking about the environment in the body, we want to start working on that acid-base balance, and so a more alkaline diet is going to help support that. Eating some raw food. Now, some patients or clients, they, with high candida load and or a compromised digestive system, may not handle raw food very well. So in this case, cooked may be better. But what you want to think about is foods that are high in cellulose and fiber. And the reason is this helps support the healthy flora, and it helps to keep candida from converting into that pathogenic form. So as I said, initially these foods may need to be cooked. Some fruit is permissible, but not a lot of fruit and not a lot of high sugared fruit. And then using a digestive enzyme is also really important as well. The types of fruits, berries in this case tend to be better. As I mentioned, green apples are really important, and fruits that are high in fiber. And then vegetables, again, those that are high in fiber and tend to be less on the sweet side. So that fiber and cellulose are pretty important because it also keeps the bowels moving as well. An allergen-free diet. Cow dairy is potentially a big contributor to acidity in the body. It can cause congestion, inflammation, and can stress the immune system. And so in one sense, you need to take the allergen foods out and then the acidifying foods out from the daily diet. And this is going to allow the intestines to heal better. And it's also going to help the mucus lining, the bacterial flora, and the Peyer's patches, which is the gulter in the immune system, to heal in the gut. And then I always kind of recommend specifically if you can get the cow dairy out or test to see if they have a cow dairy issue, then that becomes really important as well. Now, the last two pieces here, having a diet that's high in omega-3 essential fatty acids is important. And the reason is because it helps to enhance the cell membranes and the electrical kind of balance within the cell membranes, and it helps with cellular metabolism, transmission of those neural signals, helps to oxygenate the tissues, supports healthy flora, and especially the ones that manufacture omega-3 and omega-6 in the gut. And then finally, with Candida patients, when you're working with them, you want to make sure that they have a really good, strong digestive enzyme that they're taking with all their meals to help break down that cellulose and fiber, and then also that they've got some coconut oil in their daily diet. Coconut oil naturally contains caprylic acid, and caprylic acid, if you can imagine, kind of pokes holes in Candida and makes it less viable. So that's a good food to help address with Candida. Now, before I move on to the next slide, we did get a question here from Laura regarding protein. So with all protein, whether it's animal protein or plant-based protein, it's still limited to 60 grams, at least initially, while you're working on the acid-base balance in the terrain portion of it. And so thinking that, for kind of a 3-month period, but also if you're thinking biologically how the body works, the body can only, for the average person, process 40 to 60 grams of protein a day. Anything beyond that becomes excess acid that the body has to actually detox out. And so it's almost a general rule as far as the 60 grams plant-based and or animal protein to limit that to 60 grams a day if you're following a more alkaline diet. And then maize, about the grains, again, if there's grains that people are sensitive to, then you want to keep it out. If they have a gluten sensitivity, then it's important to keep that out as well. If the grains are okay, then in a Candida diet, whole grains are better, not processed grains. You don't want anything that's going to be highly processed, that's going to act like extra sugar in the body. Things like oats actually become very great because they're also really high in fiber, and they're sustaining for longer. So grains can be permitted, but they have to be thought about in what grains and kind of what the person's reaction to grains is in the first place. Okay, so then just a few notes about the Candida starve diet or no sugar diet. So a Candida diet, according to Dr. Rao and biological medicine, Candida diet must include some carbohydrates. And the reason is Candida is a sugar consumer. Starving Candida or Candida looking for sugar will push into its more pathogenic forms, driving deeper into the tissues to feed off glucose from the blood vessels and or capillary beds. And so you want to keep that Candida in the gut. You don't want it to go deeper in the body. You don't want it to become more systemic. So keeping it in the gut. How to do that is, number one, making sure that there is some natural sugars in the daily diet, not a lot, and they're vegetable and or maybe fruit-based. And then the trick with all of that is when you keep the Candida in the intestines and you're using a higher fiber and cellulose food, then you're going to also have bulk that's going to start to move the Candida through the gut. You're going to have improved elimination. You're going to have the ability to kind of do a bit of a cleansing of the gut as well. The increased cellulose and fiber kind of catches the Candida die-off. It can catch some of those heavy metals and toxins that are being released and help to move those out of the gut as well. And then if raw is not going to work, then cooked vegetables, and that will help reduce the gas and bloating if that's one of the symptoms, using a digestive enzyme to break down that cellulose, the pectin, and the carbs, and avoid the starchy and the high sugar veggies and fruits. Okay, so that is the notes about kind of a Candida diet. And so then it becomes easy in many cases, or easier to be able to stick to a diet like this. Now, let's start moving into the actual solutions here. So Pleoalb is one of the remedies from Germany. It's one of the Sanum remedies, and it is the most important and the star of Candida work. And so this remedy specifically is the most important one and the one that all protocols will evolve and revolve around as far as working with eliminating Candida or downregulating it. Candida or Pleoalb, it is a derivative of Candida albicans, and it's not always just specifically for Candida albicans. It kind of works globally for Candida and fungal overgrowth. So it works to reduce those Candida infections or the mycotic infections of the mucous membranes, the skin, the urogenital, and GI tracts. And it includes all the symptoms that we've already talked about as far as overgrowth, GI conditions, gas, bloating, fungus, athlete's foot, groin itch, vaginal yeast infections, UTIs, et cetera, et cetera. And again, that note about the mercury, which we'll talk about in a moment. There are some considerations as far as dosing. So the drops tend to be 5 to 10 drops once daily. There are suppositories. They're used once before bed, and so if there's vaginal yeast infections or urinary tract infections, then you can use the suppository vaginally. If it's more of a systemic Candida that you're trying to address, then you can use the suppository rectally. I should have taken the ointment. We don't have that available right now. Okay, so the Pleoalb drops are great for Candida, fungal overgrowth, gas, bloating, kind of all the digestive issues. And as I mentioned, 5 to 10 drops once daily. If somebody's chronically has Candida overgrowth, then start with the lower dose at 5 drops once a day, and just allow the body and the detox pathways to have a chance not to get overwhelmed as you're kind of working on reducing it. The drops are also great for nail fungus, infections on the skin, jock itch, and athlete's foot. It works like a natural antifungal, and so the drops can be applied over the affected area daily. And then the suppository, as I mentioned, is great for vaginal yeast infections, urinary tract infections, bladder infections, and use that vaginally or rectally to help with just general systemic yeast infections in the body. And those are used one suppository before bed. Again, if it's somebody who's had a chronic systemic Candida overgrowth for some time, once a day may be a little, or once before bed might be a little bit too intense, and so once 2 to 3 times a week would be the gentler way to do that. Okay, so I just see here that I've got a question. So as far as the Pleo-Alb, can it be taken orally and use the suppository at the same time? Yep, you absolutely can do that. And it depends on the situation as far as would it be recommended to do. Typically, you choose one or the other. However, if it's a real chronic systemic case with or long-standing or lots of Candida symptoms or lots of overgrowth, then this suppository is going to work kind of systemically in a faster way. And so in that situation, a really good approach would be to use a suppository, let's say once a week or twice a week before bed, and then using the drops orally on all the other days, and kind of rotating through that. So then that way you're kind of working from top down and bottom up, and getting that Candida reduced over time. And also just generally with Candida, it's more of a marathon rather than a sprint, because it does take, there's lots of things that are happening. Not only are you reducing the Candida, but you're also working on the terrain, and so it's not always an overnight thing. Mind you, symptoms can improve really rapidly, and people can get a lot of relief really quickly, but you still need to be working somewhere between 1 to 3 months at kind of getting the whole body kind of shifted over. The one situation, though, with vaginal yeast infections, using the suppositories, you can get symptoms under control within 12 hours really, really quickly. So, and then you just work kind of, more systemically to reduce that load in the body as well. Okay, so there we go. Got those questions answered. Let's go on. So now there's one other Candida remedy called Pleopef, and it's a Candida parsilosis species. And so it tends to be not so systemic and not so chronic, but more for local Candida infections and fungal conditions of the mucous membranes. A lot of the time you tend to see rashes or infections on the skin and in the orifices, so the mouth, and for women vaginally. And then you tend to see it in younger age groups, so infants and children, and kind of in the teenage and 20 years. I always say Pleopef is one of the remedies, or the Candida parsilosis, for you're too young to be chronic yet. So it tends to be for the younger population and or specifically stuff going on in the mouth. Okay, so then dosing-wise, it's very similar. So the drops and the suppositories, 5 to 10 drops daily, or one suppository before bed, or not necessarily daily, but a few times a week. Okay, so then let's start talking about this bigger approach to Candida. But before we do, Charles does have a question here. So can chronic diarrhea be one of the common symptoms along with gas and bloating? Yes, it can, absolutely. So if we go back, and I'm just going to pop back to the symptoms here, you can see under digestive, intestinal disturbances, including diarrhea and constipation, with chronic diarrhea being one of those things. And the reason is once you start to have Candida overgrowth, the environment in the terrain in the body is already out of balance. So there's going to be higher acid load in the body. There's usually going to be a lot more inflammation happening. There's a good chance that the microbiome at that point is already really out of balance. and even the immune system might be weakened. And so chronic diarrhea can be an indicator. It will definitely be an indicator of all those things. And then if you add the gas and bloating and, Candida kind of positive symptoms, then it can become part of that whole picture. So the idea is then if you work that terrain, again, so acid-base balance, supporting the microbiome with probiotics, the Bacillus coagulans probiotic very specifically is good for helping with chronic diarrhea. And then working at down-regulating the Candida through the Candida remedies and supporting the digestion and with the food, then you will start to see, in many cases, those symptoms improve. Okay, so let me get back to here. Okay, so this is a summary of this approach to Candida and the things to be considered. So phase 1, detox pathways, healthy digestion. So diet becomes part of this, looking at the detox pathways, making sure that those detox pathways are open. And so that means that the intestinal tract or the gut, that there's no constipation, that the liver's being supported, potentially the kidneys are being supported, potentially the lymphatic system's being supported, but very specifically that the gut and no constipation and the liver are being supported. Those are the two most important things when we're first working in that phase 1 space. Healthy digestion, in addition to the diet, we may be also looking at a digestive enzyme to make sure that we're supporting the breakdown of the food stuff. Then the next thing that we're going to be looking at in the phase 2 and 3 is reducing Candida load, reducing Mercury load, reducing the biofilm load. And that's through using Pleoalb and a binder like chlorella. And chlorella can also help with the biofilm, or using serrapeptase to help with that as well. We want to replenish the intestinal flora through probiotic and through fermented foods. And then finally, we want to rebalance the pH levels, so acid-base balance with a diet that's more alkaline and with an alkalizer. We want to promote strong immunity, and we can do that in many cases by, again, with the intestinal flora, reducing inflammation in the gut, detoxing, and acid-base balance. There's a lot of reverberation to help support the immune system in that without specifically going and using immune remedies. Okay, so then what I want to do is I'm going to go through each one of these phases. So there's the 3 phases. I'm going to go and talk through each one of those. And I know that there's a few questions that have shown up in the Q&A section, and so I'll make sure to answer those when we're talking about the different phases, about how about taking Pleoalb and then also binders like chlorella. Okay, so with the phase 1, this is about supporting detox pathways and healthy digestion. So as I mentioned before, that Candida diet, more alkaline, reduce the sugar load, and being pretty natural are all really important in that diet. And then we want to make sure that those detox pathways are open. And one of the reasons why this is essential, if we're working at this global effect in the body and making sure that we're supporting the body so that it can downregulate and get rid of or kind of rebalance that Candida overgrowth, you need to think about those detox pathways first. The other reason you need to think about the detox pathways is because if the liver is not working or the liver's congested, if the liver's not working optimally or the liver's congested or the bile's not flowing and the liver's not being able to do the phase 1, phase 2 detox, then you potentially are going to end up having some issues as you start to work on decreasing the Candida load. Part of the reason is if Candida starts to have die-off, if Candida also starts to secrete its endotoxins and exotoxins, and Candida starts to release mercury, and you don't have your detox pathways open, then you're going to have some major detox reactions with your patients, and you potentially are going to end up with Herx reactions as well. Sometimes those reactions are really scary, and those reactions are an indicator that the detox pathways are not as open as they need to be. And number two, in some cases, you're just going and pushing the body too fast, and the body is getting overwhelmed and it can't catch up with getting everything out. And then the third thing is, if the detox pathways are not open and you're doing some release of, let's say, mercury, for example, by kind of the candida dying off by reducing its numbers, if the mercury can't get out of the body, then it's going to relocate and it's going to settle somewhere else. So you're just redistributing it into the body. And again, that's where you can see some major reactions happening. And as Dr. Rao also talked about, there is that mercury-candida connection, and it's really important to make sure that we're helping to get that out of the body and bound and out of the body. So that's why these detox pathways are really important to work on before you start to even do any sort of candida work. If I'm going to emphasize anything, this is something that's really important. I've talked to practitioners who've had patients who've had some pretty strong reactions because the detox pathways weren't necessarily addressed in the beginning in a long enough or thorough enough way, and it creates a lot of brain fog, and it can create a lot of like really intense type things. Not trying to scare you, but I'm just trying to let you know the reality of a systemic chronic candida case needs to be addressed properly and gently, and allowing the body to do what it needs to do. So detox pathways, super important. The liver and the gut, the colon, become the most important things. The detox kit that we have that has A. hepatica, lymphodrop, and solidago then becomes a really easy tool to open up those detox pathways. And so the dosing is on here, so 10 to 17 drops 3 times a day, and that kit will last for about 3 weeks. Colon cleanse is our colon cleanse that helps to clean out the gut, and it can help with mild constipation to get things moving. And the dosing is 6 capsules with 8 ounces of water in the morning and the evening, so twice a day for 10 days. And that's a really good way to kind of clear that pathway out as well. And then, so that's the detox portion, to be able to do some support around that. And then to support if there's a lot of gas and bloating or the digestion is not really strong, then using Digestozyme with each meal is also really important. One of the things that to note about Digestozyme is it does have pectinase and cellulase in there, and then also another enzyme called hemi-SEB, or it's a hemi-SEB combo. And what that does is it breaks down cellulose, breaks down pectin, and breaks down bean and legume bonds. So a lot of the things that tend to cause a lot of gas and bloating, Digestozyme will help to break that down and support digestion. Okay, so that is the big part of phase 1. So we talked about the fact that there's the diet in there, supporting digestion with Digestozyme, working on their detox pathways. If a patient at this point also has a yeast infection or nail fungus, you can actually start to work in that respect using a vaginal a suppository vaginally for the yeast infection in an acute situation, once a day or once before bed for 5 days, and then every 3rd night after that. And then if there is nail fungus or kind of skin rashes, then you can start to use the Pleomorphic drops topically on that as well. In these situations, they're not going to actually cause these types of reactions I was talking about because you're working a little bit more locally in those scenarios. And also with the suppositories used vaginally, it doesn't tend to get absorbed across the mucous membrane so much, so it stays fairly local, and then kind of the discharge, everything kind of cleans out. The body's cleaning out through the mucus. So with phase 2 then, this is when you would start to add in the remedies as far as Candida. You can use a Candida Fix kit. So it's got the Pleomorphic drops to reduce the candida load and the fungal load in the body. You have probiotic 7 in 1, so you've got your probiotics to start reestablishing your microbiome, and you have basic tab, which is an acid-base balance remedy or an alkalizer to start changing the environment. So it's designed to address the environment, address the microbiome, and then start to downregulate or reduce that candida load in the body. In addition to that, Digestozyme is usually recommended still, especially if there's a lot of gas and bloating or there's the digestive powers are not very strong. Serrapeptase can be used on an empty stomach to start breaking down the biofilm and also to reduce inflammation. And then at this point, when you start using the Pleomorphic drops, you're also going to add in the chlorella because this becomes your binder. So it's going to bind on to any toxins that are secreted or released due to the candida being downregulated, and it's also going to be there when the candida is being downregulated then and starting to release mercury. The chlorella is also right there as a binder to be able to grab onto it and continue to take it out of the intestinal system. And when I talk about with Pleomorphic downregulating, so again, we talk about the idea that we're not killing, we're changing the environment, we're downregulating candida, but naturally what happens is you'll get the mycel and the pseudohyphae forms kind of backing off back into the budding form, and then the large portion of everything starts to it does actually start to die off. So we're not killing the candida, but we're changing it back into that budding yeast form, and then the huge amounts of the numbers will actually do naturally start to die off. And so that's where you will see kind of this die-off effect happen as part of the reducing the numbers. So it's not specifically something going in to kill the candida, but naturally, because the overall environment is changing, the pathogenic forms are downregulating into the back into the budding form, and you get the reduced numbers. And that's also how that mercury and biotoxin is also getting released, which is, again, why you want that chlorella in there to bind on. And at this point, eating a green apple every day for the pectin becomes important, maybe some fulvic and humic acid in there as well. Again, in the phase 2, if there's any vaginal yeast infections, in this case if it's chronic, then you would use the suppositories. And then again with the skin or nail fungus, you would use the Pleomorphic drops topically. And then you would do something called an alkaline nail bath using baking soda and warm water and soaking the hands or the feet or the nails in there once a day for 2 weeks to change the environment on the skin and on the nails. Now, the last part here is phase 3. Phase 3 is a repeat of phase 2, and so it's a can fix kit with serrapeptase, with chlorella, with digestozyme as well. And then the diet, of course, continues, and if there's any kind of leftover skin symptoms or nail symptoms, then that can also still continue to be addressed. Okay, so then before I get into these actual protocols, what I want to do is answer, there's some questions that have come up, so I want to make sure I get them because now this is a timely fashion to be able to do that. So Gemma's asking about what is recommended about to take Pleomorphic, or the amount to take. Is there a maximum amount someone can take? So if you're doing the drops, the recommendation is maximum is 10 drops once a day. And if you're using the suppositories, the maximum amount is 1 suppository once before bed or once a day. And again, you don't necessarily need more than 10 drops because these remedies, because they're in this isopathic 5X form, they really work to kind of, downregulate and get that candida back into its more budding form. The other part of that is when you're working, at least on kind of a systemic Candida type case, you don't want to push too hard too fast, because then you'll overwhelm the body's natural ability to detox and kind of clean things up. So that part also becomes important. It's not really about too much or what's the maximum amount, but instead the 10 drops once a day is sufficient. You don't need to do it 2 or 3 times a day, and you have to give the body the time to catch up to do the job that it needs to do. Okay, so hope that answers your question, Gemma. For Laura, will a binder like chlorella bind to the Candida die-off and Mercury? Yes. Chlorella specifically does both of those things. Chlorella has an affinity to Mercury. It's a very intelligent binder, and so it's the perfect binder actually to work with Candida. Chlorella also binds to all kinds of toxins, including biotoxins and the stuff that's excreted and released from the Candida, so it will help to kind of bind into all of those things. And then if you have the diet that has that more fiber and cellulose and bulk in there, then that kind of gets everything caught up in that as well and helps to just bring it out through the intestines and released. Okay, Sarah asks about the detox kit. I will have to get back to you on that one because I'm not 100% sure. And Barbell is asking, if a patient is doing a metal chelation with a doctor, is it important to do the protocol with it? Yes, that's a great question, and it's a very good point, actually. So it's kind of the opposite of what we're talking about. So we're talking about if you're working on Candida and reducing Candida, you're going to get some metal, specifically mercury release as well, other metals as well, but specifically mercury. But on the flip side, if you're doing a metal chelation and you're trying to release mercury, you can also get some Candida die-off happening as well. And so putting Pleoalb and putting chlorella in those situations also becomes really important as well. So Gemma, yes, another good clarification question. So for how many months or weeks? So with Pleoalb then, there's kind of this golden rule that I always really liked. 6 weeks with Pleoalb, and then you finish off 6 weeks with Pleopeth. And so sometimes in more sticky chronic conditions, you may be looking anywhere from 4 weeks to 8, 12 weeks, so 1 to 3 months with Candida. And so Pleoalb, you could be looking up to that length of time, but 6 weeks in many cases, or kind of doing 2 Candida fix kits, which runs a month each, that's in most cases what's going to be needed. Sometimes you may have to go back and do, with some chronic cases, it takes some time, so you might have to kind of go back and do one more round of something like Pleoalb, or, work on something and then kind of come back and revisit it. But what you'll find in those first 4 weeks, and sometimes in those first 1 or 2 weeks, symptoms get better dramatically really quickly when you kind of address the way that I'm talking about addressing it. I've had some patients that are really chronic issues with Candida and so much gas and bloating and could hardly eat anything because everything triggered, and I simply just worked on, in this case, like Candida, probiotic, acid-base balance, and diet. And within a week, all the symptoms improved. And she asked me what magic I was performing. And I told her that, it wasn't, of course, magic, but just having an understanding of how the body works and kind of, the microbiome works. So, okay. Now, I've got one more question in here just regarding charcoal or activated charcoal. So activated charcoal can definitely be a binder and can have some benefit. How I understand it is chlorella is classified as an intelligent binder. It binds onto mercury very specifically and a lot of toxins. Charcoal or activated charcoal is a non-intelligent, non-discretionary binder, and it binds onto lots of things, including good things. And so it's not always recommended to be doing that as your regular binder. sometimes you can kind of add it into the mix, but from the mentors that I have, they are generally not recommending activated charcoal as your main binder or as your only binder. Chlorella or fulvic and humic acid tend to be much better in that. Okay, so now I have a couple of protocols that I just want to get through here. I know that we've run over an hour, so I don't want to take too much more of your time for being with this webinar, but I do thank you for sticking around. Okay, so with this Candida fungal and overgrowth protocol, this is everything that we've pretty much already talked about through this entire presentation. So we want to look at the restorative Candida diet, have a digestive enzyme. Digestive enzyme is great because it'll break down the cellulose and the pectin and the bean and legume bonds specifically, and then all the other enzymes in there to support digestion. The canned fix kit, 1 to 3 kits depending on the severity of the condition. So that includes the Pleoalb, the probiotic 7-in-1, and the basic tabs. And then if it's a really systemic situation or chronic, then you could add the Pleopef drops after the Pleoalb is finished. You want to break down the biofilm using serrapeptase and or chlorella. If there is some sort of detox reaction or Herx reaction, then you would stop the Pleoalb drops immediately. Get the patient drinking lots of water, getting them to detox, very specifically the colon and the liver. And then as things kind of chill out, then very slowly reintroduce the Pleoalb drops. When I say slowly, I'm talking about like 2 drops once every week. Okay, so if 2 drops are good, then you increase it a little bit and a little bit, and just because that might just be an indicator that their body really needs some slow support. Okay, so then heavy metal detox. With the mercury, chlorella is going to be able to bind to that. And as I mentioned, the green apple a day for the pectin and the fulvic or humic acid also is pretty helpful. Then we've got the nail fungus. So again, because nail fungus is an indicator of a more systemic overgrowth, you have it both systemically and localized. You still want to go through the whole protocol to work systemically in the body, and then locally use the Pleoalb drops directly to the area once or twice a day, and then use that alkaline bath for the foot or the hand with baking soda and warm water, and you just soak, and that changes the pH of the surface, and it kind of really throws all those fungal species off balance, and then it just becomes much faster and easier to work. And so you do that bath once a day for 2 weeks, and then you can back it off to once a week for a number of weeks until things clear up. Vaginal yeast infections, again, this is an indication of a systemic problem, so you want to work systemically, so the same type of protocol we've already talked about, and then in addition to that, you want to locally work to reduce symptoms at that time, and so using the Pleoalb suppository, if it's an acute situation, every night for 5 nights before bed, and then every 2nd or 3rd night for a few weeks after that. If it's more of a chronic reoccurring issue, then you would use it every 3rd night before going to bed for 1 month. And then finally, if you've got little ones in your practice, then you can safely use the Pleopef drops. And so they're really good for cradle cap, which is a fungal kind of overgrowth that is often on the scalp, and it's kind of a flaky, fungally kind of thing on little ones, or thrush, which you might find in the mouth. And so the Pleopef is a safe way to be decreasing that load, and you do 1 drop per year of age. So if it's an infant, then 1 drop once a day or twice a day, and it can be given orally or during nursing if mom's nursing. And then infants with cradle cap, you can put a few drops mixed with a little bit of water and then apply it directly to the scalp, and then use a very soft brush or comb to kind of loosen the flakes and allow it to get rubbed off and kind of cleaned up. Okay, and then lastly, the take-home message for Candida. So we want to rebalance the body's environment. We want to support beneficial Candida and get that overgrowth reduced. And we want to reduce symptoms. And how to do this is I talked about this phase 1, 2, and 3. So we want to support a healthy gut and strong immunity. We want to repair leaky gut by working on gut symptoms. We want to have a diet with lots of alkaline foods. We want to get the pH levels back in balance. We want to decrease that heavy metal mercury load in the body in general, and then also associated with Candida. We want to address and break up that biofilm so we can, number one, let the body be able to handle that microbiome and get rid of the pathogenic species, and then two, whatever products that we're giving will have better access to do that as well. We want to replenish healthy intestinal flora with probiotics and fermented foods and do things to be able to really support that. We want to open up those detox pathways, very specifically making sure the liver and the gut is open. And then in some cases, we want to address the stress and also the emotions. And so when Candida and fungal populations are naturally kept under control through healthy intestinal flora, the immune system, and emotional balance, you're going to have Candida back into its physiological form and no more Candida symptoms. All right, and so with that, I thank you for taking the time to start to rethink about your approach to Candida. And so with that, let's dive into questions. So if you have some questions, type them into the Q&A section or type them into the chat room, and we'll take a couple of extra minutes here to go through and answer those things for you. Okay, so for the permitted carbs, Laura, I think I might have to do a follow-up email for you, or in the follow-up email. So the permitted carbs are low starch, low sugar vegetables and fruits, and some non-processed grains like oats, for example, or whole, like brown rice, whole grain rice. The main thing is, as far as carbs go, they need to be complex carbs and not simple carbs, and you want lots of fiber and kind of cellulose, whether that's cooked or raw as well. So I hope that that answers it, and of course I can get a more extensive list as well. In our Candida program booklet that we have available, there is more specifics in that regarding the actual diet, which is permitted, and then also things that are not permitted. I know it does say in there that you can't have donuts and cookies and bakery sweets, so those ones are definitely not permitted. And you can use alternative sugars like coconut sugar and stevia and some of those things as well, opposed to like actual sugar. Okay, so let me just backtrack here a little bit. Okay, I think in the Q&A section, there we go. So Barbell, how to keep the yeast in a healthy balance. So number one is to work on all those things that we talked about during the webinar to get the Candida back in balance. And then naturally your microbiome and your immune system is going to keep the yeast into a healthy balance once you've created that balance. So the key factors and then maintaining healthy balance is making sure the body's acid-base balance is in a balanced space, that making sure the diet overall is a nice balanced diet without too much kind of acidic foods or a lot of sugary, sweet, processed foods, and also making sure that the immune system is also supported because it's the microbiome and the immune system that ultimately keep the Candida in check. And so if you can get to that space, then that's how you do it. And if you've got somebody where their digestive system tends to be their weak system, then if you keep a good digestive enzyme in the mix, maybe you revisit with serrapeptase. A few times a year you check acid-base balance or pH levels, then overall it's something that can definitely, help to maintain then in the end. That was actually a good question because we never really talked about that. We just talked about how to reduce it, but then how to maintain. Immune and microbiome are your two things. And when I was talking about that yeast growing 4 days to 100 million yeast cells, that's when things are in an overgrowth situation, not in a regular day-to-day situation when things are in proper balance. Okay, and then I've got a couple of questions here. So Mace asks about using colon cleanse with diarrhea. Yeah, you can definitely use that with diarrhea. You want to make sure that you're looking to see what's going on with the diarrhea in the first place and what's causing it. So colon cleanse may or may not be appropriate at that time. There may be other intestinal support products that are better, like GI formula, or maybe NAG, or maybe Bacillus coagulans, and getting to the root of what's causing the diarrhea. Maybe Pleo-O-Ku from the Sanum line, which helps with food sensitivity stuff and kind of irritation. So yes, and I'm happy to talk about that further with you as well if you want. In some cases, diarrhea, yeah, it could be an overloaded colon, so as well. And if you're taking colon cleanse, some cases, it causes some diarrhea as part of that detox process. So, but yeah, I would really want to do an investigation as to what the diarrhea source was first before I considered doing a colon cleanse, and to see if there might be something more appropriate at the beginning to really help support the body. And of course, thank you everybody, always for your compliments. And so yes, I will put that carb list in the follow-up email. I'm making a note now to do that because it is an important part. And if somebody has to take carbs out of their diet, it's good to know which ones are still allowed in there. And then finally, David, so regarding mold and environmental mold exposure triggering Candida, so that is not kind of my area of expertise. I do know that environmental mold can, put a bigger strain on the body and on the system. And so dealing with that becomes really important. And somebody who has been exposed to environmental mold may then just overall have a weakening in the system. I'm not sure that mold specifically, environmental mold or other types of mold, are going to necessarily trigger Candida very specifically. But when we're talking from a microbiome and from a biological medicine perspective, when you have a lot of triggers in and a lot of stresses in the body, it can then create a situation where things can definitely get out of balance. From what I understand, especially from the mentors and kind of, as far as environmental mold goes, there's some other routes that you need to do to kind of take care of that. And they're not always talked about in a cross kind of specific way. With that said, if somebody does have high Candida load in the body or Candida overgrowth, then going with a Candida protocol and kind of the ones we talked about and taking all those things into consideration. It doesn't always mean all those remedies are necessary at that time, but those are the things that need to be considered for Candida work. And then we have a remedy called Aspergillus niger, which it is more the global remedy for mold, environmental mold exposure, to help strengthen the body against that and to kind of do some detoxing from that. So I would probably, in that case, without having many details, think about then just adding the Aspergillus niger into a Candida protocol, and that might be the solution for what you're looking for. And kind of that's the more appropriate remedy as far as kind of that cross-reactivity with molds or environmental mold exposure. And if you want to talk about that more, I'm more than happy to do that over email or as a phone call. Okay, and then and then Michelle just asks about including basic tab in the protocol. Yeah, as an alkalizer, it's definitely talked about, and it's part of the canned fix kit, and it is part of the phase 2 and phase 3 portion of the protocol as your acid-base balance remedy. Okay, thank you for taking your time to learn more and rethink about Candida. Good night, everybody.